Hello, and welcome to the e-converse podcast. This is the first episode on a series of discussion on the economics of healthcare, specifically the private healthcare system versus the public healthcare system. I would like first to start by introducing you the structure of our episode. We will start off by introducing the textbook theoretical framework of healthcare. And then I would give you an overview of how different healthcare system looks like, functions in different countries. And then we would attempt to analyze, compare these systems to have some understanding of how they function, what are the possible merits and failures of these systems. It's important to note that the purpose of these comparisons is not to draw a conclusion on, specifically which system is better or superior than which, but to see how the different roles different systems can play and the merit and potential failures they may have. Or maybe we could even come up with possible solutions to these problems. Okay, now let's get started. In this specific episode, I will introduce to you the three important bits that enable our further discussion on healthcare system. First, I'll introduce you the textbook theoretical framework on the provision of healthcare in a society. And then I will give you a brief introduction on one of the most common healthcare system, namely the universal healthcare system, that is basically can observe in different countries. And at last, I will give an overview of some of the most typical system represented by different countries. In here, the example I selected are the US, UK, and China. Okay, this is just a collection of news that has been displayed quite recently concerning the healthcare system, whether it's system falling apart, incredibly high drug prices, and anti-corruption campaigns, worker strikes, just to give you a brief understanding of how prevalent the problem of healthcare system is and how important the efficient allocation of resources a healthcare system has is like how important it is to our life. Okay, now let's get to the textbook bit. If you open basically any textbook, you will have this idea about public healthcare, which you hear it a lot in the news, in daily life as well. So it all started by this idea that healthcare is a merit goods. Sorry, this is a word missing. So what do we mean by merit goods here? If you open a textbook, it would say it's a good that its benefit is underestimated, or from government's point of view, that the consumers does not have enough information to recognize the benefit of such a goods. With that being said, it would lead to it being overconsumed in a free market system. So we have an underestimation of benefit, and we have an underconsumption. So, let's draw an arrow here. It's important to note that the benefit we are talking about here is not just the potential benefit to an individual. In fact, in economics, there are three types of different benefit. There is the private benefit, the external benefit, and the social benefit. I'll just write the key terms here. I wouldn't write the word benefit, just for the sake of time. So, what do we mean by these kind of benefit? Let's give a very simple example about a health check, a regular routinary annual health check. I'll just draw it here. So the private benefit of such an annual check would be maybe your health get improved, or maybe you get to prevent some of the diseases. So basically the benefit you get as an individual, as the consumer. Okay? So what are some of the external benefits? For example, if you experience a better health, then maybe your family, for example, they can reduce the time taking care of you, reduce some of the financial costs taking care of your illness. But they are not directly involved in your consumption of the annual healthcare check. So they are a third party and unrelated third party. And for example, your employers who may not have to pay the insurance cost, who may not have to experience you taking leaves, reducing the efficiency of work, things like that. So for example, your family, okay, that's not a very good drawing, but your family, maybe potentially your employer, who also get the benefit, but they are the unrelated third party to your consumption. So that's an external benefit. So what's a social benefit? You can tell that by just looking at the word social society. It's actually pretty simple. It's just the sum of the first two benefits. The overall benefit in a society, the private benefit plus the external benefit. But in a free market, let's imagine this is a free market system. As an individual, maybe the cost of an annual check is high. Maybe it takes me a lot of time to get to the hospital. Maybe there's a big queue. Maybe I think it's just not worth it. It's just not worth the trouble. So I am not taking the overall benefit into account. I'm probably just taking my own private benefit into account. That leading to my consumption of the annual healthcare check. I mean, me under consuming the annual healthcare check. I mean, if you talk about it as a good. And that leading to the decrease of social benefit. I'll just write it here. So, as a government point of view, there is an underconsumption of this particular goods. And as the role of government would attempt to encourage the consumption. And there are several ways of doing this. Government can implement, a handful of policy. For example, it can impose subsidy. It can directly provide the good healthcare itself. It can through transfer of payment, which you may see, we see here during the vaccination program during COVID, where government give transfer payment as an incentive to encourage people to take the vaccine. And government can set a minimum price for some of the goods, for example, drugs. There's a lot of ways that government can intervene to encourage consumption of healthcare. In most cases, we would see that government do it in a handful of ways, not just combining these policies together. But there's also another important thing to note, that why government have the responsibility or may intervene in a situation like this. The idea of equality. Not only for the economic consideration of all sorts of benefit, but access to healthcare is just like access to education. It's a basic human right. And there is a lot of ways that through the provision of healthcare and through the provision of education can income and wealth be redistributed in a society. Well, let's just see a very simple explanation. Let's say this is a relatively rich person, and the tax, usually the healthcare system are funded by tax. Ensuring equal access to healthcare, but I'm not just saying the tax is from this particular person, but from these three persons. But with equal access to healthcare, some of the income or wealth in a society is redistributed through the provision of healthcare. Thus, not only ensuring equal access to healthcare, but also improving the situation of the rich and gap pool, of ensuring more equality in society. So this is just an oversimplified version. I'm just giving you an overview of what are the potential considerations and behind this public healthcare system. Okay, with some of the basic principles or ideas being said, let's look at the most general form of healthcare system. The universal healthcare, or the universal healthcare coverage. Oops, I didn't know it was capable of doing that. This universal healthcare system is a very, very common system in which is observing in most of, well, actually in every developed countries except the US. Its basic idea is it's a healthcare system in which all residents of a particular country or region are assured to access of healthcare. So you can see it's very much linked to this idea of equality. This system is first invented in Germany, adopted from the Bismarck's model, and then later on being adopted by many other countries, and now a lot of the developing countries have it. We'll not really dwell onto that. We will move on to talk about our 3 examples of the US system, the UK system, and the China system. Most of the discussion will use the US system and the UK system as contrast. So now let me give you an overview of how these systems look like. I think we want to change color. So if we put a healthcare system onto a scale, this is not official, but this is just a very arbitrary demonstration of what kind of system they have. If we put it on a scale, on a spectrum, we would find that US on the end of being private system, and on the public end we would have UK. Well, it's not exactly here, it's somewhere near. None of this is exact. There is no such thing as 100% public healthcare system or 100% private healthcare system. And I think we would somewhere find China here. I'll explain to you why I would put it such way. But it's important to note that both China and the UK has this universal healthcare coverage, whereas the US does not adopt such a system. Okay. So this is a graph by the OECD healthcare statistics of 2021. Okay. Let's find where our country. This is the United Kingdom, and somewhere here is China and the United States. Okay. I think a different color would be more suitable. So you can see that almost 80% of the healthcare expenditures are from public sources in the UK. And it's through direct government transfer. So the UK has this medical system which is pretty unique, despite it has a lot of similar versions across Europe. But the UK has this NHS, the National Healthcare Service, which is funded by the general tax. People have access to healthcare regardless of their contribution to the system, their contribution to general tax. And the healthcare, except dental and a few other services, are largely free at the point of use. You can see this, almost 80%. And China has about, slightly less than 60% of public sources coverage, and this is half by social insurance contribution and by government subsidy. The United States has about, roughly 50%, I would say. This is less than 60%. This is roughly 80%. Just saying roughly 50% public healthcare coverage, and you can see 36% of it is covered by general tax and 13% is by social contribution. Okay, I would start with this is a very perfect explanation of how the US healthcare is covered. This is the sum of population, and you can see it's divided into different groups. The Medicare covers people age 65, and the military covers, well, apparently the military employee bits. And the non-institutional people, which majority are covered by an employer-based system, which is a form of private insurance. This is not directly linked to any government-provided programs, so sometimes if you lose your job, you can lose the insurance. It all depends on the insurance contract, to be honest. But you just have to note that this is a private insurance provided by different kinds of insurance companies, not by any form of government or public programs. And there is the other coverage. The Medicaid is provided by the government for low-income groups. And there are a few other coverage of different kinds of groups. And there is on average about 30 million uninsured population in the US, which accounts for about 8 to 10% of its total population. So these people have no access to any kinds of healthcare insurance, whether public or private. It's important to note that there are these three different kinds of, well, actually it's more than three. We have the Medicaid, but we'll just simplify a little bit to the Medicare, the private, and the uninsured. Please take a note of this because it's going to have a huge role in the different kind of access these people have in healthcare. Later on, we'll have more discussion on these. Right now, just note it in mind. If we're talking about access, then the current data is that the United Kingdom has ensured about consistently 100% of access of its total population to healthcare. China has been able to maintain somewhere above 95%. China is kind of slightly different. To me, it feels like the mixture of like both. So China has this what they call employee medical insurance, and there is the resident medical insurance. So employees basically that the employer would pay a portion of the medical insurance, and the employee as an individual would pay a portion of it, and a portion is by government subsidy. The resident is paid by the individual and by the government subsidy. So it's kind of like somewhere in between, like what I just said here. Like China is somewhere in between the two systems, but still way more leaning towards the public provision of system, public provision of healthcare. And here's another important dimensions other than the two dimensions we've talked about so far in terms of how the systems are structured, funded, and what are the accessibilities of different systems or the coverage. And this is another important thing about different countries' situation is the healthcare spending, the healthcare market in different systems. And you can see here it's kind of very, very famous that the US has the largest healthcare spending, the largest healthcare market in the world. It accounts about on average 17% of its GDP. We're talking about post-pandemic data. And here the United Kingdom has around post-pandemic roughly, I'm just saying roughly, I'm not giving you the exact data, just to give you a brief understanding of it because the data varies slightly from year to year. An average about 10% of its total GDP. cannot find China in this chart because China's healthcare market is still growing. China would be somewhere around 6 to 7% of GDP. All right, China here. Okay. So all of these set is just to give you an overview of what kind of system, what different players um, have in the system, and what kind of the roles they have in terms of private firms, private healthcare providers, pharmaceutical companies, government employed, some of the public hospitals, public healthcare services, and the fund. And just to give you an overview of the different kind of systems we're having in the world right now. Having all this information would be very useful later on when we start to actually analyze what are some of the pros and cons of different systems. Okay, I think that's enough for today's The E-Converse podcast. I'll see you in next episode.